put leaves. Okay? Caraway seeds, I don't know what that is. Cinnamon, yes, you need to put cinnamon in everything and not sugar. Cinnamon good in milk, right? In yes, very good. Yes. Curry powder, garlic, and garlic powder, not garlic salt. Garlic salt got salt in it. Garlic powder is just straight garlic. Ginger, everybody know what ginger is. Lemon extract, maple extract, marjoram. What is that? People who cook. Tom, you cook. You know what that is.
It's a spice.
It's a spice and herb. Mustard powder and nutmeg. Okay. Haitian people, poivla, that big pepper. I don't think Caucasian people use it. Do y'all use the thick pepper? I don't even know. Jamaican use it, but I don't think Caucasian.
Pimented.
It's the big peppers. Big. You don't cook? Yeah, but yeah. I don't know why they use that. That might choke you. Right? So these are what you use to season a food without salt. One that's not here, wash the mouth. If the mouth is clean, anything tastes good. Clean the mouth. Listerine. Why? Guys, you know before you eat, you're supposed to rinse your mouth with water. And before you sleep, you know you're supposed to brush your teeth. Who don't brush their teeth before they eat? You know what? You wake up and they're ugly. Ew. I used to brush my teeth before, like classes. I don't do that no more. Because you talk, your breath starts. You always like Miss Sonia. Well, Miss Sonia. Right? Okay. Any questions? Right? Okay. Carb consistent diet. This carb consistent diet is for diabetes. Now let me explain something to you. A lot of students feel when you're diabetic you should not eat carb. Diabetic patients do eat carb, but you gotta watch how much carb you eat. A lot of people say, girl, you better stop eating that sugar, you're gonna be diabetic. False. Obesity causes diabetes, type 2, right? Diabetic patients need carbs. So for example, if this morning he drank a whole glass of milk, right? Lunchtime he wants to cut back his carbs. That's what they call that carb exchange, the exchange system. You cannot spend all day eating all fatty stuff. You got it? But diabetic patients need protein, you need carbs. Or you're going to go into hypoglycemic crisis. Okay? Okay, every time it's mango season, people giving you mangoes. Mangoes high in what? Sugar. So mangoes is good for you. It's refreshing, but not every day.
What about diabetic patients?
When a diabetic patient's sugar goes down, the mango doesn't have enough sugar for it. It doesn't. It doesn't. They need something else. It's not enough sugar. Okay? Now, sodium restricted. You're going to put NCLEX on this one. Turn. Here it is. Watch. NCLEX asks you, or they put, what does the lady say she needs further teaching? The doctor put you on a 2 to 3 gram sodium diet. Let me tell you what that means. 2 to 3 grams sodium, look, is this. Here, take this and add a little salt. 2 to 3 grams is take this and you can put a little salt on it, period. 4 gram diet, here, don't add no salt. Any question? 2 to 3 gram diet is here. You can put a little salt. You remember we did electrolytes. When you don't have enough salt, what are you at risk of? No, I know hyponatremia, but what symptom the patient can show you? Seizure. Too much salt, seizure. Too little salt. Okay, so 4 gram diet, I put all the salt in the world for you. Eat this. That's it. 2 to 3 gram, take it. You can add a little salt. Very big on NCLEX. The diet the doctor will give you, either 4 gram or 2 to 3 gram. That's it. They will not give you nothing else. 4 gram, meaning I already add all the salt for you. Just eat it. 2 to 3 gram, you can put a little salt. Any question? Protein restricted. Here it is. Remember I told you, who cannot eat protein? Liver problem, right? Renal problem. Hepatic mean liver. All right, guys? So sometimes NCLEX put hepatic, and the student go, what that mean? Hepatic mean liver. Nephro mean kidney. All right? Make sure you know that. Renal diet. Right? Who normally is on a renal diet? People with renal failure. Yes, people with dialysis, right? Foods, right? Control amount of protein, salt, calcium, potassium. Make sure you know that. Restrict fluids. Anytime I'm on dialysis, people, no fluid. Every time I got left heart failure, no fluid. Yeah, I'm retaining. Okay? Now, O, you're going to put NCLEX. Potassium. Okay. Now, you remember we did put, guys, you remember last week, electrolytes goes with this chapter. So if you didn't have time to review the electrolytes, you in trouble. Remember we went over potassium, right? And what did I tell you potassium is used for? Muscle contractility. And our heart, the biggest muscle, right? So let's look. Ready? Low potassium is indicated for hyperkalemia, right? When we get to this disease called diabetes insipidus, which I'm going to talk about in endocrine, you will see that, right? Addison disease, right? These patients here have potassium issue. When you have Addison disease, your potassium is high. So we want to give you food in low potassium. You got it? And high potassium diet is indicated for hypokalemia, which may be the result of renal, tubular acidosis, GI losses, diarrhea, vomiting. Cushing disease, which is potassium is low, you will give the patient food high in potassium. Now give me, from last week, which food high in potassium? Fish, banana, tomatoes, potatoes, orange, raisin. So guys, this is where NCLEX get you. When you go to NCLEX and you got your letter back and you fail, let me tell you where this come in. You saw where it says risk reduction and management on your letter, this is what you fail. Fundamental. They have fundamental with infection control. When they say risk reduction, because what they're asking you, which diet, right? And you did not know. You must know which diet go with what disease. All right? Okay. Now, high calcium. You remember last week, calcium live where?
In the bone.
So when it leaves the bone, it goes into the okay. So high calcium. People who need high calcium are people who have osteoporosis. So an osteoporosis patient have two problems. They got falls and they got kidney problem. Why? Bone, because the calcium left the bone. Kidney problem, because all the calcium went into the blood. Any question? So, osteoporosis patient, right? Before you give them high calcium, you want to give a lot, and I give you on this, and it don't make sense. Listen to me. Listen. I ask you, what food you give osteoporosis? You say high calcium. That's what you tell me. You tell me that, but you don't even think. Remember, listen to what I told you. Calcium lives in the bone, it leaves the bone, and goes to the blood. So if you give me high calcium, it's going to go in the blood. So they're going to give me kidney problem. So what you must give me first is calcitonin to push it back into the bone before you give me what? High calcium. The students, and I look at them, they look at me, you crazy. Listen to me.
Yeah.
Because any calcium you give me, it's going to go where? To the blood. So you need to give me a drug first to push it back. Then you give me all the food with calcium and vitamin D, so you won't lose it. So boom, you get it wrong on the test, you get mad. Go get the book. Go get the book. I say, go get the damn book, right?
Mrs. Sonia,
Yes.
for a patient that's in dialysis, what is the total calories intake for the day would be?
It depends. A patient on dialysis. First of all, you gotta watch their salt intake. We do not want to say 1,200, and you want at least 1,500. Why? Because remember, dialysis patient, they look like a COPD patient. Big stomach, frail leg, T-CORBT. So you want to give them boost, but you don't ensure, but you don't want to give them too much. So you do give them about 1,500. Some doctor may go to 2,000. 1,200, 1,000 calories, too small. They need not so much protein, but they need that calorie because they skinny here, big here. Stay away from the salt.
Between 15 to
2,000 up to the doctor. Stay away from the salt. Right? And they, because people like that, they say, hell, I'm dying anyway. So, and they eat whatever they want to eat. COPD patient. Right? Any question? Low perine. Perine, if you eat a lot of perine, right? Where are perine found? In expensive fish, caviar, shrimp, lobster, big scallops, mussels, expensive stuff. So therefore, when you eat a lot of those food, right? Those food produce what we call purines, which have high uric acid. So all of the uric acid goes into the blood, and the patient have a disease called gout, right? So it's because of high uric acid. That's why patient with high uric acid, you give them allopurinol choline to remove the uric what? Acid. Okay, so high food, organ meat, yolk, right? Not, excuse me, I went to the wrong thing. Caviar, pardon, caviar, sardines, right? Anytime you eat food high in purines, it causes a high increased uric acid, guys. You need to give the patient a lot of water. And anytime I have high uric acid in the blood, you need to cut your vitamin C. Because vitamin C causes what? Kidney stones. High in vitamin C. Open citron cause kidney stones. So you got to give them a lot of water. All right? Make sure you know that. Diet, high iron. Okay, on my test, I gave a PEDS test last night. And I asked the student, what is pica? The student put is anemia. Pica is garbage that cause anemia. Who pica? Pica timon mange dead. Pregnant people mange wash. That's dirt. That's pica means garbage, which causes anemia. Didn't she tell me pica anemia? I said, I didn't teach you that in my class.
I have a question or something.
Yes.
For a patient with gout,
Yes.
would you recommend that the patient stay away from vitamin C?
Yes. Why? Because, guys, gout has increased uric acid. If you take a lot of vitamin C, it causes high what? Uric acid. So you give them water. Guys, if I have a lot of uric acid in the blood, the kidney don't work. So bio to wash the what? Wash the blood. Wash the uric acid with water. Yes, so the kidney can work.
Is that the same acid when you do exercise that releasing?
No. When you do exercise and you pull a lot of weights, there's something called lactic acidosis that release to the bloodstream. It's not the same because this one make you sick. Muscle breakdown. Alright? It's not the same. When you take metformin, you see you have like a flu ache, body ache, your body's stiff. You can't even sleep. You don't know which way to sleep. Okay? Any question? Yes, ma'am.
Do you have any idea why somebody keep on having kidney stone once you had surgery? They keep on coming back.
Is it a man or a woman?
Oh man.
A man. A man. I don't know. Is the man obese?
No.
Then they need to check. Will he work out?
Yeah.
Okay, they need to. That's your husband.
Yes.
Okay. No, I'm serious. They need to check something going on with his muscles. They need to do an EMG on him because what's releasing is acid from his muscle. What she was talking about. They need to check his muscles. He have that same thing what the Haitian guy, the fine Haitian guy that came to the hospital. It's called rabioidosis. Yes, when you work out and it releases in the blood. And that's what causing his kidney stone because he's not obese. If you would have told me she's African American, right there, obesity. But if he's not skinny, if he's not obese, they need to check if he lift weights. All right? Okay. Vegetarian diet. 12-9. I want you to put NCLEX, right? Vegetarian diet. Okay, lacto-ovo, right? Lacto-ovo. Consume eggs, milk, but exclude me no. Put no. When y'all see exclude me, then no. But no meat, no poultry, and no seafood. Lacto vegetarian. Lacto vegetarian. Consume dairy, but exclude eggs, meat, poultry, and seafood. Guys, when you want shit, serious, they kill y'all dead right here. They say the patient is on lacto vegetarian. Which food would you question? You see, vegan, all animal. So how am I going to get my protein if I'm a vegan? Ready? Soy. Tempeh, T-E-M-P-E-H. They say Kawal is a vegan, meaning Kawal don't eat no meat. How will Kawal get her meat? From her protein, from soy, tempeh, tofu. Number five and 6. Pesco vegetarian. You consume seafood, but exclude meat, poultry, eggs, and dairy. Guys, serious, no joke, know this, guys. Don't go in the people's door without this. Why? Because a lot of people are vegan. A lot of people don't eat meat. So you have to know what you can eat, what they cannot eat. Which one the patient need further teaching? You want this one, please. Okay? Now, here is the big one. TPN, page 122. Okay. Yes.
When you say which one you teach the patient, you have to tell them what they don't have to
No. Which one you will question? C'est ce qui sa patient dit pas bon. So c'est pour te connaître qui ça bon.
You have to take the one.
No, a lot of people no serious have problem with answering these questions. Further teaching. When they say further teaching, qui sa patient dit pas bon. So pour répondre question ça, c'est pour comprendre ça bon.
Oh, you have to take the good
You have to know what's good. Which one the patient needs follow up.
Yes.
That means patient said something wrong. So if you don't know what's right, you see that? So you got to understand. Do y'all understand that? And that's why the students say teaching. Everything is teaching. Oh, the students say priority, Miss Sonia. Priority is, Kawal, I want you to go to Walgreens, I want you to go to Publix, and I want you to go to Macy's. But to look for a bag for me. But somebody say Macy's got it for $300 less. Which one is your priority? Why? Macy's have it 300. Priority mean A is good, B is good, C is good, but I'm looking for the best. That's what priority is. So anytime you see which one priority, you better know A, B, C, D is good. everything is good. You got it? Okay. Now, this section, all I need you to study, and I'm going to make it very nice, is this page here, the one that don't have a page number. I want you to put your little note. I cannot open Pearson door without knowing this page. Forget about this page. That we're going to focus on this. Okay? This one. It don't even have a page number on it.
Yeah.
Okay?
You're right.
Now let's go. Y'all know who went. Y'all know these were the questions that came out. Anytime you giving TPN, what is TPN? I'm feeding you through the vein. Meaning I'm giving you food via IV. That's what it is. Anytime you're going to be on food IV more than 3 days, we cannot do TPN. We gotta do PEG 2. PEG 2 is more years. You got it? But TPN meaning I'm giving you food via IV temporarily. Why? Because something here not working. So therefore we're giving you food through your vein. Any question? That's what TPN is. Now, TPN come in 2 bags. 2 bags. One long bag, one short bag. The short bag has less lipids. The long bag has vitamin. That's it. TPN must be witnessed. Whether you LPN can hang TPN or N can hang TPN. TPN is hung for 24 hours. The big bag has vitamins, electrolytes. It's yellow. The little bag is white. Both bags, TPN, the lipids and the vitamins are highly in sugar. Boy, highly sugar. So anytime a patient gonna have TPN, you must treat that patient like a diabetic patient. Again, anytime a patient is on TPN because the food is highly in sugar, even the patient not a diabetic patient, you're going to treat that patient as a diabetic patient. What do you mean, Ms. Sonia? Do blood glucose on them every 4 hours, right? And have insulin on their chart. Any question?
No question.
Nice. Understand. So depuis on moun dit TPN, I'm feeding you temporary via IV. That's it. Now, this page that does not have a number on it, and NCLEX berry, manjou, they kill you so much on this hill. Dead, dead, dead. They ask you, what can go wrong when a patient is on TPN? Let's go. All the things. We're going to list what can go wrong, and then we're going to talk about how to prevent it, and we're going to talk about if it happened, what to do. So, Kawal on TPN. What can go wrong? Air embolism, high sugar, hypervolume, low sugar, infection, pneumothorax. So these are complications of TPN. Everybody say that. These are complications of TPN, which is what? Feeding via IV. Nice. Now, first complication is air embolism. Oh, what happened? Well, when I was feeding the patient, the IV tubing is broken, so air got into the line. Next one, sign and symptom of this patient, apprehension. Guys, apprehension, c'est comme ça, regardez. Restlessness, chest pain, dyspnea, hypotension, respiratory distress. Intervention, if it happened, what to do? Mainly place the client left side with the head lower and notify the doctor. So let's do it first. We go position the patient, give the oxygen, and then call the doctor. How to prevent it? Make sure all catheter connections are secure. There you go. This is how the people ask you. But let me tell you what they do to you. They ask you intervention. You go give them prevention. You see? So you got to know what air embolism is. You got to know what causes it. Silent symptom. Intervention. You know that's, hey, if you a nurse, NCLEX asks you intervention. Stop. If they, what to do if it happen. Left side, right? So they got left side, notify the physician, administer oxygen. They don't ask you that. They ask you which one you going to do first. Left side first, oxygen, then call the doctor. Of course, if it's connected, you clamp, right? Side, oxygen, call the doctor. Who cares how NCLEX asks it? Because you understand it, so therefore you're going to what? Answer any question. So this is a complication that happens when you are given TPN. The first complication Miss Sonia taught you was what? Air embolism. Who care what the people ask? Who care what NCLEX come with a dumb question? You comprehend. But the problem is, you didn't comprehend at all. So when the people say TPN, hell, you didn't know what the people was talking about. But now who cares? You see it? When you understand, it doesn't matter. The second complication is high sugar. Miss Sonia told you the medication is full of sugar, the food. So you gotta treat this patient like they're what? Diabetic. Client is receiving it either too quickly, not enough insulin. What can happen? Coma, yeah, because polyuria, polyphagia, polydipsia, right? So intervention, right? High sugar, notify the physician, may need to slow the infusion rate, give insulin, monitor blood glucose. Which one you gonna do first? Hey! Wait a minute. Who said monitor? Go give me the aliment. Listen. Hey, no, can you please stand up and who said, because you right, but I want to help you. Who said monitor sugar? Okay, Rose, listen. Listen, Rose. Listen to what she said, and I want y'all to stay out of this. I said, the patient have high sugar. Then I already did the monitor. So you got to go on to do. You are, I said high sugar, Rose, so you already monitored the sugar. So let's go. The patient's sugar is high. What to do? Reduce amount. Slow down the infusion rate. What else? Give insulin and then call the doctor. Don't say call the doctor because it's understood. Anytime a patient on TPN, you going to treat them like a diabetic patient. So why you going to call the doctor? It's understood. See, that's how I'm going to do the class with y'all now. So it can stick.
But when the doctor put in the already in the...
It's already good, baby. It's understood. Okay? It's understood. All right? We keep it on. Yes. Ready? Slow down the machine. Slow down the machine. Give insulin. Right? Call the doctor. Don't, and then you can start monitoring it again. Guys, you see when you understand stuff so pretty. Okay? Now, I got a question, but I'm going to hold it. Hypervolume. That means anytime the doctor order TPN, TPN at 100 cc per hour. You never started 100 because we got to make sure the patient can tolerate. So you do 20, then she tolerates, then you go to 40, and you keep going up all the way to get to 100. If you do it too fast, she's going to have fluid in her lungs. That's why anytime you give TPN, you got to monitor her lungs. Listen to her lungs to make sure the food is not going into her lung so she don't aspirate and die. Ready? Huh?
I have a question. You say if the doctor order 100 cc per hour?
If he ordered to put it at 100 cc, because he have to tell you how to run it on the pump. Don't stop. He order it. Don't go put 100 like that. We gotta make sure she can tolerate it.
So if you're doing 20, like would you do 20 for the first hour? Then you do
No, baby. You do 20. She talk 15 minutes. She doing good.
Okay.
Then you go up. No, not 20 an hour. You 20 when she good. No breathing heavy. She no pain. Umute. She doing good. You do it slowly. You don't just push 100. That's some good nurse stuff, right? So, now, excessive fluid, right? Sign and symptom. If it goes too fast, bounding pulse, crackers in the lung. So, anytime you give TPN, you must assess the what? You must check the what? Sugar, assess the lungs. You see that? Why would you check my LOC? The first one, air embolism. Because if air, I'm going, remember pulmonary embolism, early sign is restlessness. Late sign is what? Dyspnea. Huh? If I start LOCing, who is this? Who you are? Where is this? It's because air has entered. Guys, stick with what you learn. These are things that can go wrong when you have TPN. Air embolism, hyperglycemia, hypervolume. So hypervolume, too much, that means it's going too fast. You will slow stop, fluid restriction, diuretics, or dialysis. Now, which one you will do first? Slow stop. Slow stop. Next.
Fluid restriction.
Fluid restriction. Call the doctor so you can get what? Diuretics. And listen, the doctor will never put Lasix on a person's chart that's getting TPN, but he will always put insulin. Why? Because it's understood that if the patient needs Lasix, that's a medical emergency, you better call. You got it. Certain things, if it's well understood, it doesn't need to be explained. Comprendre. If I put Lasix on Maggie chart, that means I knew Maggie, it was going to happen. Lawsuit. So if you call me, that means now I'm going to reduce and say, instead of 100 cc, put it 60. It's too much for the patient. You got it? Hypoglycemia. Why? if you stop it abruptly. So here's the NCLEX question. You walk in the room. Margaret was on TPN, the machine stopped. Stop. What is your initial nursing intervention? Google. Okay, listen. Somebody say assess. Who said that? Okay, now listen. I walk in the room and the machine stopped. What do you do first? Okay, monitor blood glucose. Who said that? You got to stand on what you believe now. You said that, Rose. Hooray. Listen, now remember, it is understood that when you're taking TPN, your sugar will be elevated. So it's understood when the TPN stops, your sugar gonna be low. Why you gonna go monitor the sugar? So the first thing you do, the machine stop. You go to the kitchen. You go get a little sugar with water, make it like baby. You take your glove and you do this in the patient's mouth while you go get your blood sugar. Go get your thing to stick because you're tricking the brain to think the machine is still running. Right? Listen, when you walk in the room, there are 99.9 the patient's sugar drop, but you don't know that. It's okay. You don't know how long. So what you're going to do, just to make sure the patient is okay, while you do your investigation, you're going to go get sugar, water, because if you give patient dry sugar, they're going to choke. Make it watery. Take your glove and the brain thinks the machine is still going, so the patient won't go into hypoglycemia while you trying to figure out why the machine is off.
But Sonia, can you just start the machine now?
No. Remember, don't go start. First of all, pharmacy has to go give you another one because bacteria. You got it? Okay. Or the doctor will order IV dextrose. Then you monitor blood glucose. You see, guys, anytime I walk in a room, I did the assessment. Stop going to assess. I walked in the room. I found patient on floor. That is the assessment. Why you said check patient? Hell, I just did. Then go into intervention. I'm getting y'all on this. I'm getting you guys on this because y'all still is Kaplan business assessing. Guys, if I walk in a room, I just did the assessment. So you got to go straight to intervention. Rose said check the blood glucose. Okay, watch. Rose say check the blood glucose. I did. I checked it. What did it do for the patient? But the water with the sugar, what did it do for the patient? Prevent the patient from going into what? This is why students fail that stupid NCLEX. Not because you don't know. It's just that, that's that critical thinking. Yes.
So if you're a nurse and then there's a patient, you walk in and you find them on the floor, then that means you said that you already assessed them by finding them on the floor.
When the patient is found on the floor, you check the patient's pulse. Because you gotta tell me, right? The patient have a pulse. So automatically you know the patient alive. So what you gonna do, go check some more vitals?
That's what I'm saying, how you put a question like that.
Because it goes like, I found patient on floor with breathing, they gonna add some more stuff. That's the assessment.
So without that, not acceptable.
Yes, because anytime you walk in the room, you found the patient on floor, that is a damn assessment.
So not even the rest of the parts.
It don't have to, it's understood. That's a nurse, you already know. So once I do the assessment, you go straight into intervention. Because it's never gonna be two assessments twice. So I said, the patient is on TPN. I walked in the room, the machine is off. Then Rose say, check the glucose. I know when people on TPN, the food has a lot of sugar. I don't need to check blood glucose. It's understood. I need to do something for the patient. Those are the trick questions. And that's why I'm trying to get you to put your brain cap on and turn it up and answer these questions. And that's why I need you to beef up on your content. Beef. When your critical thinking is not there, you need to beef up on the comprendre. So however way they give it to you, you still can slide out. Because I know about TPN. That's why I was able to answer it. You don't have to tell me sugar. Yes, you can. Do you understand where I'm coming from? Okay, and when I first started the class, I said, anytime you on TPN, we must treat you like diabetic. You got it. Okay. Infection can happen for several reasons, guys. It's plastic, it's IV. What would you see? Fever, chills, elevated WBC. So you walk in the room, the patient is on TPN, the patient have a fever. Patient have a fever. And guys, it's not you walk in the room, they're going to give you a temperature. Was assessment done? Yes. What's next? Intervention. So there you go. Patient have a fever. Nurse, what you going to do? Temperature. Somebody say take temperature. Go hey prends aliment ap gaz la. Ma poule dernier building. I know. What that means, when they make mistakes like that, I say go get the gas and the match. We need to blow them up. That was totally right.
Can we check the sides of the insertion to see if there's any sign of?
Okay, listen to what she say. Listen to what she say. Can we check the side of the insertion? Listen to what she say. She ain't wrong, but let's help her out. The patient, you walk in the room, the patient have a fever of 100.2. What's priority? Let's check the site of the insertion. I checked it. What did that do for the fever of 100.1? There you go. So ready? Ready? Let's go. Can we stop it?
Yeah.
We can stop it. We can stop it, but what must we do? No. Stay with me. I stopped it. Go get them some sugar water. I got you again. Because if I stop it without doing, he went from infection, now put him in hypoglycemia. So let's stop it. Go give him a little sugar water so his brain can still thinking it's working, right? Stop it. Maybe give him like a little warm, a wet compress. Call the doctor because the doctor, when you call the doctor, going to order antibiotic, but he's going to ask you for something. he's going to ask you to take a culture of the catheter. The catheter, not the site. The catheter. You see, she said, go check the site. Check it. Guys, our goal is to help the patient with the 100.4. Checking the site going to do what for the 100.4? Okay, but stopping it, doing the culture, call the doctor, going to do what? A lot for the fever of 100.4. Yes. You got it? Yes. Fix the problem. Stop assessing stuff already there. Patient got high blood pressure. What's priority? Check the blood.
No.
See, it don't make sense. You got it? All right. Any question? Make sure you know that. Now, how to prevent this from happening? How to prevent from happening? Where did I teach you that? Blood hanging, IV. Change the tube. Anytime you giving food, you change it every what? Every 24 hours. You change the whole line. How often you change the dressing? Every 3 days, 72 hours. And don't make stuff touch the floor. Everything nice and clean. You see that? So I can ask you cause, I can ask you sign and symptom, I can ask you intervention, and I can ask you prevention. And the problem with the students, the people ask you intervention, you go give them prevention. So again, before I go to pneumothorax, what are the complications that it can occur when you have TPN? Air embolism, high sugar, high volume, hypoglycemia, infection, and the last one, pneumothorax, where air enters. So they will put a what? Chest tube, which I will show you in client with a tube. Any question? Who can get a question on NCLEX on TPN? They run. Nobody. Who NCLEX can get a question on the vegan diet? What is lactose? Those different vegan diets will run. Nobody. If NCLEX asks you a question on vitamins, who's going to run? Nobody. NCLEX asks you who gets what diet, what system, fundamental, nutrition. Any question? All right. Okay, we're going to take a break. I'm going to sign my bill. I'm going to push this through today. Yes. No, change the dressing, baby. Remember, TPN, I'm feeding you IV. And sometimes they put it here too, which is highly infection. Where I'm going to teach you guys about all this, the IV blood hanging.